While cases of COVID-19 continue to slightly decrease across Minnesota, hospitals are still feeling the strain caused by this global pandemic. This morning, Dr. Jon Pryor, Essentia Health president, is connecting live with us. Good morning, Dr. Pryor.
Good morning. How are you? Thanks for having me.
Yes, thanks for being on with us. So I just want to get right to it. How is the situation at Essentia Health right now?
Better. And I want to thank everyone in the Northland here for doing their part in terms of social distancing and wearing masks and avoiding crowds, because that has really helped. We had inpatient census weeks ago that was up in the 80s, and we're now down in the low 50s or upper 40s. So far, so good, and I'm just asking people to keep up the good work.
That's great to hear, but you are concerned about a surge in the coming weeks, possibly after the holidays, right?
Right. So I don't know how people did during the holidays. There's a lot of concern out there that families gathered and they weren't all in the same bubble. And so and there was some holiday travel, obviously. And I understand those pressures, but we are concerned. There could be a surge that comes in another 1 to 3 weeks, and we're worried about that. And we're also a little bit worried about, I feel the optimism. This vaccine makes me very optimistic. There is light at the end of the tunnel, but I worry about people letting their guard down. So we still have many months to go here.
Right, exactly. As you said, the vaccine is coming out and now people are getting inoculated with it, but it's still many months before the general public could see this, right?
Yeah, so I think by the end of January, we're going to be through phase 1A, which is primarily people in long-term care facilities and health personnel, and then they'll start rolling it out to the general public. They've got a tiered system. I think it's a wise system. I mean, it's trying to get our most vulnerable people vaccinated first. So people 75 and older, people who have chronic diseases, diabetes, things like that. And then they'll work their way down in terms of age. Because as you know, most of the hospitalizations and most of the deaths have occurred in the elderly and those with specific medical conditions. However, I just want to remind everybody, you can be 20 or 30, you could even be a child and have long-term effects or even die from this. So we can all be affected.
Exactly. So looking ahead in 2021, what is your optimism for the year ahead?
I'm optimistic that sometime in the summer, maybe mid or late summer, that we're going to feel like this is over. There's still going to be cases out there. I mean, that's just my projection. I'm no expert. I'm not an epidemiologist. But I think for two reasons. One, we'll be vaccinating the most vulnerable. Two, once you hit the summer and people get outside, it's relatively hard to spread outside, especially if you maintain social distancing. So I think those two factors are going to make it feel like we've got a relatively normal summer. But until then, for us to do that, we need people to still keep their guard up during this very long winter.
Right, exactly.
Mask, social distancing, avoiding crowds.
And my last question for you, there seems to still be a lot of misinformation out there about COVID-19 and now the vaccines as well. What would you say, who should we trust for this news that's coming out?
So I would trust the experts. I would trust, the physicians, the researchers. They're, in general, they are very data driven. And this is a good vaccine. It's around 95% effective. It's safe. Obviously, with any vaccine, there can be side effects. Most of the side effects are basically just a short shoulder, maybe some headaches, slight fever, all very mild in general. And so I would encourage everyone, if you get the opportunity to get a vaccine, please get it. You do not want COVID. I can promise you that. The risk of the vaccine is very small, and if you get COVID, it's just not good. You will not like it.
Dr. Pryor, thank you for being with us this morning. We appreciate it.
Thanks a lot. Thanks for doing this.
Yes,
Take
here's
care.
to a happier, healthier 2021. Now let's get to check the forecast with Ken.